Hello, everyone. Thank you for joining us today. Today, we will be hosting a webinar on coping with stress and compassion fatigue in health center settings. And this will be the first webinar of a two-webinar series. This is provided to you by the National Center for Health and Public Housing. So before we get started, these are just a few housekeeping items to go over. This is just a reminder that all participants are muted upon entry. Please make sure to engage in the chat if you have any questions or comments that you would like to share with us. Please raise your hand if you would like to unmute as well. Towards the end of the presentation, we will be going over questions and answer section. This meeting is also being recorded, and the slides and recording link will be sent to everyone via email after today's session. This is just a reminder that the National Center for Health and Public Housing is supported by the Health Resources and Services Administration and is a national training and technical assistance partner, which is financed 100% by this grant. This information or content and conclusions are those of the author and should not be construed as the official position of policy or endorsements inferred by HRSA, HHS, or the US government. Also, the mission of the National Center for Health and Public Housing is to strengthen the capacity of federally funded public housing primary care health centers and other health center grantees by providing training and a range of technical assistance. So now we'll be passing it on to Dr. Jose Leon, who will be going over our public housing data and other information.
Thank you, Fide. Good afternoon or good morning to you, depending on where you are in the country. It's such a great pleasure to be part of this activity. As Fide mentioned, this is a two-webinar series. I will be going over the introduction of this important topic that has been a big issue for all health centers since COVID-19 started, and it's created a lot of issues, not only in primary care, but at any hospital setting. And wherever you have contact with patients, the amount of stress has increased. So for the next webinar, we are going to send an invite to all participants and all those who registered to this webinar. We are going to have the National Council for Mental Well-being presenting some of the resources and toolkits that they have to address this particular issue. As Fide mentioned, the National Center for Health and Public Housing provides training and technical assistance to over 385 community health centers across the nation who are in or immediately accessible to public housing. In 2021, the latest data that we have available from the health centers through HRSA, over 1,300 health centers provided services to almost 30 million patients. 458 of these health centers reported to be in or immediately accessible to public housing, and they provided services to almost 6 million patients. This is almost 25% of the health centers across the nation. And 108 of these 458 health centers receive funds from HRSA to provide services to those living in or immediately accessible to public housing. And in 2021, they provided services to over 900,000 patients. Next slide, please. According to the U.S. Department of Housing and Urban Development, there are some very interesting demographics that I would like to go over so we can better understand the population that we serve. There are over 1.5 million residents living in public housing. 38% of the households reported to have at least one person with disability. 19% of the household reported to have at least one person who is over the age of 65. The households also reported to have, or 36% of the household reported to have children under the age of 17. 32% of the household reported that they are either female, they are female-headed households with children. In regards to ethnicity and race, 43% of those living in poor housing are African American, 52% are white, and 26% reported to be Hispanic or Latino. Next slide, please. The Centers for Disease Control and Prevention, CDC, and the U.S. Department of Housing and Urban Development developed a publication, the Health Picture of House Assisted Adults, 2006 to 2012. And they created this excellent table showing that those living in public housing or those receiving assistance from HUD are more likely to be overweight or obese, have some type of disability, have diabetes, COPD, and asthma, and over 35% reported to have or to be in fair or poor health. Another data or another topic that for us is really important is smoking and smoking cessation. HUD in 2016 banned smoking in all public housing developments, and of 33% of those living in public housing are current smokers. So we have been working with community health centers, with public housing developments, public housing agencies, to make sure that they receive all the resources and the materials that they need to address this big issue affecting those living in public housing. As you know, smoking can make some of these conditions worse or worsen some conditions such as diabetes, increase the COPD rate, affect the heart of those living in public housing. So there are more chronic medical conditions that are linked to smoking, and this is a very important issue again for the National Center for Health in Public Housing and for the public housing development, as well as those health centers that are public housing primary care grantees. Next slide, please. So today we are going to go over three important issues. First, we are going to describe how compassion fatigue affects all health care workers. Then we are going to determine the signs and symptoms of compassion fatigue, and we are going to provide some tools and resources to avoid recurrence of severe fatigue. Next slide, please. I was doing some research, trying to find some data, and there were a couple of highlights that I would like to mention that really grabbed my attention. In the United States, more than 3,600 healthcare workers died during the first year of the pandemic, and all over the world, the World Health Organization estimates that between 80,000 and 100,000 health and care workers could have died from COVID. There is no specific data, since some countries were unable to provide accurate data. But the medium scenario, according to the WHO, is that almost 116,000 healthcare workers have died from COVID, helping patients and helping those who were or have been infected by COVID during the last 2 or 3 years. And during the COVID-19 pandemic, thousands of healthcare workers lost their lives. They put their own health and safety at risk so they could heal and comfort others. And this is one of the main reasons why during the pandemic we had all these compassion fatigue issues of burnout. Next slide. So before we get into the nitty-gritty of compassion fatigue. The compassion fatigue is the physical and mental exhaustion and emotional withdrawal experienced by those who care for sick or traumatized people over an extended period of time. Even though it's very similar to burnout, they have a difference, and burnout is caused by everyday work stresses, dealing with insurance companies, making treatment choices, and compassion fatigue results from taking on the emotional burden of a patient's agony. So burnout is something that we can experience through the stress that we have every day. We deal with electronic health records, with an increased number of patients, with blood work results, with a patient asking for resources. We deal with low-income populations, and sometimes they are uninsured. We need to help them with the medications that they need to. Sometimes they don't understand the instructions that we are providing. So all these cause burnout in our healthcare population, healthcare workers population. And however, when we are discussing compassion fatigue, this is an extended period of time, and we're taking care for the sick people. We know what these patient are going through, and it is more specific than the burnout, which is caused by daily stress. Next slide. So ICD-11 has a burnout definition, and it's basically a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed, and is characterized by 3 dimensions. First, when we are burnout, or when we are experiencing burnout, we have feelings of energy depletion or exhaustion. We have an increase on mental distance from one's job, or feelings of negativism or cynicism related to our job, and that results in a reduced professional efficacy. However, burnout refers specifically to the phenomena in the occupational context and shouldn't be applied to describe experiences in other areas of life. Next slide. The Office of the U.S. Surgeon General created a toolkit, and they have this document. We are going to provide the resources when you receive all the information on the slides and the recording link. But when we are going to address burnout, we need to address it not only addressing the individual or addressing the healthcare worker, but if all these parts related or that are in close relationship with the healthcare workers need to address the issues. So this slide shows that there has to be changes in the healthcare system, changes in the organization, in the community health center, and the workplace and learning environment. So in regards to issues that we need to improve in our society, is that we don't have to make politics with an issue like this. COVID-19 was politicized, and we had many people discussing the disease without any medical knowledge or any background information or data. That created a lot of stress, that created a lot of confusion, that created issues with the vaccine confidence. So those are the issues that at the society level we need to improve. The other thing is that that we are going to see is how burnout also affected more those ethnic minorities working in healthcare settings. The health misinformation that I mentioned created a lot of stress, burnout, and issues, not only to the general population, but among community health workers and health workers in general. Then we need to address the mental health stigma. We are afraid of discussing issues related to mental health, even medical professionals, when they are affected, they don't want to talk about this. It can show some weakness. And so we need to make sure that we address stigma, and that mental health is, as any other condition, something that we need to address without stigmatizing those having mental health issues. In regards to the healthcare system, we need to improve our technology, improve our communication channels. We need to make sure that we make easy for health providers to do their job. And again, the best example that we have is the electronic health records issue, which is extremely useful, but it takes a lot of time. It takes a lot of energy. It takes a lot of the time, and sometimes we spend a lot of time working on electronic health records, and we dedicate less time to our patients. So we need to make sure that all those issues are improved. From an organizational perspective, we need to improve the leadership. We need to make sure that we have the support of our leaders, the support of those making decisions at the organizational level. We need to make sure that we address the workload for each and all providers, and those working with patients, and those working in healthcare settings. And we need to make sure that bias and discriminatory structures are addressed, and try to eliminate the barriers to mental health and substance use care. In regards to the workplace and learning environment, we need to make sure that we have time, that we dedicate time to the providers, making sure that all the needs are addressed, everything that they are referring in regards to how difficult it is to do their job. Any harassment, any violence and discrimination should be addressed as well. And making sure that there is a better communication between those leaders or decision makers and those taking care of patients. Next slide, please. The same document that I am mentioned, and again, we are going to share this document in case you are not familiar with it, but is really interesting to see the numbers, and specifically related to the time that we spend with our patients and the time that we spend with electronic health records and documentation. According to the document, for every hour of direct patient care, physicians currently spend 2 hours on the electronic health record systems, and nurses spend up to 41% of their time on EHRs and documentation. So this is it has been really helpful, the way that we exchange data files, that we have we are able to communicate, we are able to send information and files to other organizations or within our organization, making sure that we address and everybody who is taking care of a patient knows exactly the condition, the medications, and the social determinants of health affecting patients. But at the same time, it's taking a lot of the time of our providers and our nurses and everybody who is involved in patient care. And that is creating a lot of stress, burnout on our clinicians and those caring our patients. Next slide, please. Now, when we are talking about burnout, these have many consequences. Not only it affects health workers, but it affects patients, it affects the community. and even the healthcare system. So healthcare workers have a lot of signs and symptoms, and the way that they work is not ideal, who suffers the consequences in addition to the mental health, uh, um, in addition to the mental health status of the healthcare workers are patients. Because when a healthcare worker has burnout or has been diagnosed with burnout, they dedicate less time to patients. They have the quality of care decreases. We are more likely to have medical errors. So this is something that we need to make sure that every time someone refers or someone is going through burnout, we need to understand that it's not only affecting the health worker, but our patients and our organization as well. Next slide, please. In regards to those who have been impacted by the pandemic, and specifically healthcare workers, we can see that there is some groups that have been more likely to be affected and impacted. Those are health workers of color. These minority sometimes are working not only taking care of patients, but at the same time, they are in the process of, for instance, cleaning the facility, helping the patients, receiving patients, being in contact with patients. When we have someone who gets to the health center and has symptoms of COVID, all those receiving and talking to patients, most of them are a patient of color, as well as immigrants. Health workers have been affected and have been more likely to develop some issues, not only because they are close to patients and therefore they can get a COVID, but at the same time, they have been impacted and they have suffered burnout. These immigrant health workers help in the facilities, helping patients in interpretation, help in making sure that patients understand the instructions, making sure that the patients have access to the services that they need. Female health workers have also been impacted. Those low-wage health workers in rural communities, we have fewer health workers in rural communities, and therefore the number of patients that they see impact how they react or respond to this daily stress that they suffer. And same issue with those health workers in tribal communities. Next slide, please. This is an example, a case study. The American Academy of Family Practitioners had this interesting example, and I'm quite sure that many of you or many of those attending this activity are very familiar with this, with what we are going to describe. But Andy had always been an energetic and dedicated family physician. Now at 38, he is tired, cynical, and lonely. He's angry at the healthcare system for forcing him to see more patients in less time, and annoyed with his patient for what he perceives to be their increasingly demanding natures. Although his relationships with his patients once thrived, they no longer seem to give him the same satisfaction. Even talking to his wife, who's always been a supportive partner, has not relieved his feelings of intense isolation. And so this is a really nice example of how a clinician and or a nurse or someone who's in direct contact with patient and taking care of our patients can develop these symptoms and as I mentioned, is going to affect not only the clinician, but the patients and all of those who are around, including the colleagues who are working with this person and taking care of the health issues affecting our population, or the populations that we serve. Next slide. When we see some of the, we've been in contact with some of the health centers. We've been in contact asking them what the needs are. And burnout has always been the number one priority, or at least one of the most important priorities. And those who are administering vaccines, for instance, and I have highlighted in yellow what all the issues that are related to the topic that we are discussing. And the very first person said individuals are wanting to leave the healthcare industry due to exhaustion and not enough pay. Another one said we are experiencing turnover from staff with burnout or higher salaries. A third person said tired workers, not enough workers. And everybody was experiencing a staff shortage, a burnout. Those were the main concerns during the COVID-19 pandemic, at least when we had the peak of the pandemic. Next slide. So we develop compassion fatigue when we have burnout due to all the stress that we have, and a secondary trauma, which is basically taking care of a patient that we get emotionally involved, and we want to help this patient and making sure that this person receives all the healthcare that they need. And now, how can we avoid the compassion fatigue? We are always going to have some kind of stress. We are always somehow are going to get involved with some of our patients, but the difference is that we need to have some satisfaction, some compassion satisfaction, which is basically another concept that I would like to introduce, and is when we are getting the feeling that we are helping others, that we are fulfilling our goals, that we are helping our patients, and that that satisfaction can be developed by some of the techniques that we are going to mention, at the same time some of the relaxation techniques, and making sure that we have the group of people around us who are going to support us and who are going to be the person that we need to talk to in order to make sure that we avoid compassion fatigue. Next slide, please. There are some warning signs of compassion fatigue. I'm not going to go over all of them, but depending on the resource or the website or the organization that you go and try to find information about compassion fatigue. One of the main symptoms, and this is something that which is extremely important, is the use of drugs and alcohol or food. We are this is one of the ways how people and everybody, not only clinicians or those taking care of patients, but anybody who is under a lot of stress tend to abuse on drugs, alcohol, or food. We have anger, blaming, chronic lateness. We need to make sure that even though burnout is the stress and the due to the daily activities that we do and that we are responsible for, we need to make sure that we also address depression and anxiety. We have some symptoms that people who are under this kind of syndrome or affected by this syndrome can also have like a frequent headaches and gastrointestinal complaints. Next slide. And all the mental health issues like sleep disturbances, low self-esteem, less ability to feel joy, irritability, and hopelessness. So anything that is, if you have a provider, if you have a nurse, if you have a social worker, if you have any of your staff having any of these symptoms, we need to make sure that we address these symptoms and we provide the help that they need. Next slide. The American Academy of Family Practitioners on their website have this questionnaire. They have a few questions that you can answer either yes or no. And if you answer yes to 4 or more of these questions, it may indicate that you are suffering from compassion fatigue. This is one of the shortest and probably easy, very easy to complete survey where or questionnaire where you can just make sure that you can self-administer, or if you are taking care of any of your colleagues, you just to go over all any these short questionnaire, we can see whether or not this person is at risk of compassion fatigue or is being affected by compassion fatigue. Next slide, please. You may be familiar with the professional quality of life scale with this questionnaire, which is a little bit longer. You can you can see whether someone is being affected by either compassion fatigue, compassion satisfaction, or if it has even a PTSD diagnosis. And next slide, please. So this is the way that you can read it and you can score it. Again, we are going to share these resources with all of you after the webinar. All these resources, including the slides, and the recording will be sent to everyone. Next slide, please. When we address compassion fatigue or burnout or any stress related work-related issue and creating a stress, there are some couple of things that we do and a couple of things that we don't have to do, and we can address this from the provider perspective, which in this case is going to be a patient perspective, and the organization perspective. From a provider perspective, for in this case a patient perspective, they need to find someone to talk to. It's always imperative to talk to someone to make sure that you express the feelings and what you are going through. And only by doing that, there will be some kind of communications and sometimes we can free some of the stress, some of the symptoms that we have. Understand that the feeling is normal, that if you are under a lot of stress, that if you are experiencing like a high volume of patients and or you are going over, you probably lost a friend or a provider. That is normal, is a process that everybody goes through. Making sure that we understand that this is nothing that has to do with us, is just part of the normal process that we are just experiencing. The more important thing is to exercise and eat properly, get enough sleep. If possible, take some time off develop some hobby, develop some activities that is going to distract us from the daily activities that we have. In my case, I run. I try to do it every day, at least 45 minutes, making sure that I have the exercise and the sleep that I need. But at the same time, to me, that's a hobby. There is a group of people where I live, and we try to get together early in the morning and go for a 45-minute run and have a conversation about things that are unrelated to what we do every day. That helps and that relieve the stress and help not only providers, but anyone who is going through a burnout issue or a fatigue issue. And then there are other hobbies. Listen to music. There is a lot of people, and having a conversation with some psychologists. When we discuss the music, for instance, we tend to think that soft music, that those those musicians like Beethoven or those are the best because the music is very relaxing. But even other types of rhythms are really interesting. The Hispanic community, for instance, they like salsa, and just the different rhythms that you can have and beats, and that relaxes a lot, and that's something that is very recommended. And there are other like Zumba, meditation, and yoga. So let's try to develop some kind of hobby or something that is interesting, so we can stay away from the daily issues that we face. And more importantly, let's identify what we really like outside of our work, and let's do it just to be with our family, relatives, have a long trip, go to another place. That helps a lot. So those are the do's when we are affected by any of these two issues that we are discussing. Next slide, please. The don't of recovery, the most important one is don't blame others. That creates additional stress, that creates conflict with the person that you're talking. It's not a good idea to look for a new job, to buy a new car, or to get a divorce or have an affair. Those are things that probably are not good ideas when you are going through this process. Or hire a lawyer, or work harder and longer, or self-medicate. And again, that the use of recreational drugs is not recommended. We tend to come home after a long day and just drink some whiskey or beer, and probably that's not a good idea because it can create other issues in the long term. Next slide. So the main points when we are talking about the do's and don'ts is don't make big decisions, don't blame others, don't spend your time complaining, and don't try a quick fix. We need to look for professional help. We need to make sure that we have the help of those who understand the issues, those who are expert of these issues, and making sure that this is something that can affect anyone, that stigma does not have a room, and that we need to make sure that we are clear and sincere when we are experiencing any symptoms, so to make sure that we are going to go over the recovery process. Next slide. Recently, technology has also given us some apps. There is a study. This is a study in regards to how you can manage your stress through some apps. And this particular study ask participants with questions on what are the best apps, or what are you looking when you are trying to relax and use an app. And the most important one, or the very first apps that people are looking for, are those with sounds, with some breathing exercises or meditation on mindfulness, music, and hypnosis, food and nutrition. So there are a lot of apps that are out there that can help us, decrease the stress that we are going through. And many of these apps are free, and that we can make sure that based on what we like, we choose the right one. Next slide. A couple of them by name. Is not my intention to recommend one or saying that this one is better than the other one. But the first three, according to this study, are the Mebel by Thrive, the Stress Management by Nazim, and Health Foods Now by Top Free Apps Tips. Those are, according to this study, the top three, and those that can be used by providers or by anyone who is going through this burnout issue or satisfaction fatigue issue, and they can use these applications. Also, Google is YouTube is another place where you can find some videos that can help. There are a couple of them. I used if you do a search and type on YouTube minute meditation or 5-minute meditation, and you will find some videos with really good music and relaxation techniques that can help, and it can take just 1 minute or 5 minutes of your time. Next slide. Again, the self-care and stress management, we have already gone through try to be physically active, let's try to sleep and eat well, try to avoid increasing use of alcohol and other recreational drugs, stay in contact with loved ones, and turn to colleagues for contact and support. Again, the use of the apps, the use of that we need to exercise, we need to make sure that we find a hobby that we discuss, that we have a group that is not the group that we work with every single day, and just have fun and try to stay away somehow from the daily issues that cause stress in our lives. Next slide. Other studies on relaxation techniques. One is the visualization technique. This one is basically to get in a room and try to find, close your eyes and imagine a really nice place where you would like to be. It can be a forest, it can be the sea, a beach, it can be any place where you find some times of relax, and try to make yourself in that particular place. That helps a lot. It doesn't need like a lot of your time. Again, 5 to 10 minutes. Others discuss that the progressive muscle relaxation is an excellent relaxation technique. You can start from your feet and go over your legs, your pelvis, your abdomen, your thorax, until you get to your head. and just try to relax each of the muscles. That helps a lot. Meditation, for those who like to meditate, again, if you go to YouTube, you can find 1-minute meditation, 5-minute meditation videos that are extremely good. And there are other breathing techniques, humor. If you like to write or draw, that is another way to relax. The spiritual and religious practice is extremely important for those who are believers, and again, seeks professional support. Extremely, to me, this is the most important one. And let's try to find a professional, like a psychiatrist, psychologist, or anyone who is involved and who is familiar with these two particular issues, burnout and compassion fatigue. Next slide. So we need to address all of the issues. It's not only the person. We need to make sure that everybody is involved, leadership, all those who are in the administration of a health center, those who are providing the mental health support, those in the technology, and so we can create a culture of healing and community and connection. And overall, there has to be communication. And these three show all these branches, and all these branches are interconnected, and making sure that everybody is involved so we can have a healthier or a workforce. Next slide. Again, so if you are, we've been discussing and talking about what a provider can do, but we have also changes in the organization, making sure that we have an assessment that is extremely important, making sure what the needs, we need to know what the needs of our workforce are, and let's go back and see the policies and practices that we have in place, how we are helping our staff members, what we are doing, what we can do to enhance the workplace efficiency, how we can better communicate and have a culture of connection and support. So everybody needs to be involved, and we're talking about the CEO, the CFO, the CMOs, and everybody who has who is involved in the activities that are part of the life of health centers, and even the board, making sure that the board understands the issues and provide the board with some solutions. So that involves all of us trying to find ways to reduce stress, to reduce burnout and compassion fatigue. Next slide. The health, what other things health centers can do? We need to empower our health workers and be responsive to their voices and needs, making sure that we hear them, making sure that we address the needs, show them that we are really interested in helping, showing that we are here to help, that we are here to address any concern, and not only the mental health or the stress or burnout, but any other mental health issue affecting our workforce. Making sure that we have that this is seen and this is addressed by the highest levels of leadership. We need to make an assessment and regularly assess, measure, and respond to any occupational distress. And very important, establish a zero tolerance policy for violence and institute a workplace violence prevention program to address violence and abuse in the workplace. And this includes physical, verbal, and cyber-based violence. Next slide. Other things that we can do, or the health centers can do, is making sure that this is that we have a safe environment. We need to prioritize anything that is related to the needs. In the very beginning of the pandemic, we had issues with personal protective equipments. We had issues with the staff was also worried about family, relatives, and making sure that we address all these. We remember that we are talking about human beings, that we are talking about people who also have the same feelings, the same fears as anybody else. We need to review and revise policies to ensure health workers are not deterred from seeking appropriate care, making sure that we address substance use disorders or anything like alcoholism, and making sure that we have the resources to help our staff. We need to increase access to high quality and confidential mental health and substance use care for all health workers, develop mental health support services, and very important, combat bias, racism, and discriminations in discrimination in the workplace. Next slide. So the key points or the takeaway points here is that compassion fatigue is a form of burnout that manifests itself as physical, emotional, and spiritual exhaustion. To prevent or recover from compassion fatigue takes time. There are no easy fixes or there is no easy fix. Take time for self-reflection and identify what's important and live in a way that reflects it. From a organization perspective, we need to make sure to sustain yourself at work, but at the same time develop principles of practice, guidelines of personal integrity, and commit to live and work within these principles. And again, for the health worker, for the health centers, assess any of the needs of the staff, and making sure that we help them with all the needs so we have a healthy workforce. Next slide. Believe that that's all. This is my contact information. Again, this is a 2 webinar series. For the second webinar, which is going to be the last week of January, we are going to have the National Council for Mental Wellbeing. They have developed some resources, and they have agreed on sharing the resources with the health centers. So we are very happy. We are very pleased and excited to have them. Also, at the end of this webinar, there is a short survey. Please complete the survey. That helps a lot to improve our webinars. And if you or if you're looking for additional information, similar or other webinars or resources for similar topics or other topics affecting your community, or any of the emerging issues like diabetes or mental health issues or substance use disorders, or anything that you are looking related to emerging or existing issues affecting health centers, visit our website at www.nchph.org. And I'm going to stop for a moment. In case if you have any questions, please feel free to either use the hand raise icon and your line will be unmuted, or you can also use the chat box or the Q&A box, and you can type your question.
Okay, so it looks like we have one question. I'm going to go ahead and unmute. Give me one moment. Okay, so. Okay, yeah, my mistake. We actually don't have a hand raised. But if anybody else would like to provide a question or a comment about the topic.
Well, if there are no questions, I want to thank everyone for participating in this activity. Happy holidays to all of you. And again, the resources, the recording, the slides, and the questionnaires that we shared, as well as the document from the Surgeon General will be shared with all of you. The information on the next webinar, the link to register will also be sent in the next few weeks to those who participated in this activity. Thank you so much and happy holidays to all. Thank you.